challenge will always be, how can you demonstrate that what you're doing will impact the hospital positively and also give the impression that we are constantly working to improve upon the secureness of the hospital. And I think that's really a tough sell. I think that you have to show that your vision is beyond this week or this month. I think you have to show that you have a vision for not only when things go well, but you also have a vision of how to address issues when things may not go as well. And how are you planning for all these areas and constantly keeping yourself updated on the different trends, the different threats that are out here, and how you keep moving forward in a positive manner. And also look for the members in your organization, not only just your senior leadership, which I think you should start with, because I think the most effective programs, the most effective implementations of anything in an organization really start from the leadership. If your senior team, if your senior leadership feels that the implementation of something to make the organization better is necessary, most of the time this will happen. And I happen to have had that advantage here, is that my leadership was completely committed on making sure that we were able to implement a program that will provide a overall enhancement of our security. And we called it Safe and Secure. And we called it Safe and Secure because Safe and Secure was exactly what we wanted. You know, our patients told us that, our staff told us that, the visitors told us that. They want to feel safe when they walk into the hospital. And they want to be secure in the knowledge that not only the security knows what it's doing, but they want to be secure in the knowledge that we thought about them. That we physically said, when someone comes in this building, what is our idea of safety and security in this building? Part of security is making sure that we all feel that we have a place in securing the building, to the organization. And I think that was the real issue, was to get everyone feel a part of the environment and to begin to engage at a real level. You know, a lot of times everything is done from a 10,000 view, and they sit upon and say, well, we're going to put things here, we're going to put things here, we're going to move people around, but no one actually talks to the people. No one really talks and say, how does this impact you? If we put a card reader here, if we put something that will restrict access to this area, how does that affect your operations? And when I say the different levels that you have in the hospital, I mean, you have to talk to the physicians, because their needs may be slightly different. Their urgencies may be different from, say, a nursing staff. And then you have to talk to the nursing staff. Everyone who has a role in the hospital should and do feel as if their part of their job is as important as anyone else's. And I think if you embrace that understanding, you'll go a long way with developing a real comprehensive security program. And that actually takes a lot of hard work, because you have to sit down and listen. You have to attend meetings where some may be very pleasant, some may be quite hostile, because in the past they may have felt that no one's listened to their concerns. So you have to kind of vet through that. You have to listen. You have to be willing to have, you know, a little tough arm on there and go in and take some of the lumps. But at the end of the day, I think the feedback and the actual implementation, they feel more proud of the system because they know that they were thought of in the process.